Dr. Sandy Bowen is now giving evidence in respect of child B. She confirms she has examined medical records, case notes and photographs for child B and peer-reviewed Dr. Evans' report for a non-fatal collapse in June 2015. Child B collapsed at 12:33 a.m. on June 10, 2015 at the neonatal unit. She later recovered and 4 weeks later was discharged from the Countess of Chester Hospital. Dr. Bowen says child B was compromised at birth and required respiratory support, which was not that unusual for someone of her prematurity. She stabilised very quickly, Dr. Bowen added, and was in air with normal blood gases and stable enough to have skin-to-skin contact with her mother and for feeds to be started. Dr. Bowen said the circumstances of child B's collapse were not normal, but, quote, very concerning. She said, quote, despite being on CPAP, she was otherwise normal. If such babies deteriorate, there is normally prior warning, but there was nothing to suggest she was going to collapse in this way. The prosecution referred to an event where the nasal prongs were dislodged prior to the collapse. Dr. Bowen said the prongs can be misplaced and the babies are probably quite uncomfortable, and if left for a prolonged period of time, there would be a desaturation with prior warning. She added, quote, it was noted, the prongs were replaced and everything went back to normal. Dr. Bowen replies to the question if the misplaced prongs had anything to do with the subsequent collapse. Quote, no, none at all. Dr. Bowen said other factors such as infection or cardiac arrhythmia could be discounted, and the only conclusion left was air embolus. She refers to the skin colour changes seen on child B, and how florid and different it was from anything they had seen before. She said, quote, it just didn't fit with any other potential different causes. Dr. Bowen said she looked at child B's case on its own merit, as with any other when coming to a conclusion. Ben Myers KC for Letby's defence is now asking questions to Dr. Bowen. Mr. Myers asks if it is important that medical experts have current day-to-day experience in a medical environment. Dr. Bowen replies, not necessarily no. What you can't do is dispel the experience they have had over many years. She adds that it is not crucial that they have on-the-job current day-to-day experience. After further questions, she said such experience would be advantageous. Mr. Myers refers to GMC guidance in giving evidence as an expert witness, and asks if someone who retired from clinical practice is still in the same position to give evidence for events which happened in 2015. Dr. Bowen says someone does not lose their knowledge after retiring from on-the-job clinical practice, especially if they keep up to date with clinical practice, they are not at a disadvantage. Dr. Bowen said the first time she had contact with other medical expert Dr. Evans was earlier this year. This was to discuss one of the cases in the trial via a telephone conversation, as there had been a difference of opinion. Dr. Bowen said she had previously seen one example of an air embolus and it was in a neonatal case, but was, quote, very long ago. She said she could not recall the specifics of the case, but the air bubbles seen in the imagery were, quote, very striking. She said she had formed her views after excluding other possibilities. Dr. Bowen said she is unaware of any genetic condition which would cause a baby to collapse and die within 24 hours. She said genetic screening would only be done if staff had a suspicion the baby had a genetic condition. Mr. Myers says Dr. Bowen said child A was, quote, extremely stable prior to collapse. She said there was, quote, nothing which was cause for concern. The blood gas record for child A is shown, and Dr. Bowen says the lactate number of 2.6 to 2.7 is slightly elevated. A normal reading at the Countess was 2, but this has to be taken in context with other parameters which were normal. The NICU observation chart is shown to the court for child A. Mr. Myers says the respiration rate is not stable. Dr. Bowen says it's above the normal rate, but it is stable. She said the range is 60 to 80 breaths, which is outside the normal range, but with CPAP breathing support and in air. She said during the afternoon there would have been interventions which would have caused the respiration rate to rise. She said the respiratory rate, in conjunction with other factors, would have been something staff would have been aware of. Mr. Myers asks, would you say this was an alert? Dr. Bowen replies, yes, but there was nothing else that needed to be done. He wasn't having a lot of desaturations. The next step would have been to ventilate him, and he didn't require that. Dr. Bowen states handling in a baby with respiration support can make the respiration go up. Mr. Myers asks if the heart rate would also go up. Dr. Bowen replies, it can do, but not necessarily. Mr. Myers refers to the insertion of the UVC and long lines. Dr. Bowen said the long lines were not in the best position, but was in a fine position that was safe and would not cause problems with the heart. Dr. Bowen said a long line can move if left in for 2 weeks or more. She said the long line would not have moved in the space of a day, and the recommendation is not to x-ray every day. Mr. Myers refers to child A's lack of fluids for 4 hours. Dr. Bowen said it was not okay and would not be optimal care, but he had no IV access and the doctors had to prioritise other matters on duty. She adds it wouldn't cause a sudden collapse like with child A. The only deterioration he could possibly have would be a drop to his blood sugar. Mr. Myers asks, would you agree the whole situation is suboptimal at that moment? Dr. Bowen responds, no. Mr. Myers asks if the lack of fluids means the whole situation is suboptimal for child A. Dr. Bowen replies, no. Mr. Myers refers to the skin discoloration. Dr. Bowen explains there is a difference between a rash such as chickenpox and changes to colour in the skin where it can go blue or pale or mottled. Mr. Myers refers to a paper published by the International Journal of Critical Illness and Injury Services on air embolisms, which reports air can enter via the UVC during negative pressure in the vessel systems. Dr. Bowen says she knows this sort of thing can happen, but in adults, and is not aware of any neonatal cases. Mr. Myers now refers to the case of child B. He says the UVC procedure had to be repeated with her. He asks if that was suboptimal. Dr. Bowen replies, no, but ideally you would want it in the first time. A clinical note refers to child B not getting fluids for a couple of hours. He asks if that was suboptimal. Dr. Bowen agrees. Mr. Myers refers to a clinical note showing it took 5 attempts to insert a long line for child B and asks if that was suboptimal. Dr. Bowen replied, 5 attempts is what it took. It's incredibly difficult to sight these, they are 1 millimetre wide. At times it just won't thread for you. You are very aware that you are handling this baby and the easier thing to do is to take it out and reinsert it. She adds, rather than fiddling about with it in the baby's body. Dr. Bowen agrees there were breathing problems for child B at birth. Mr. Myers asks, do you agree that child B could deteriorate without deliberate harm? Dr. Bowen replied, it is a possibility. Mr. Myers asks, air embolus is usually fatal, isn't it? Dr. Bowen agrees there is a risk. Dr. Bowen says a small quantity of air could create an air embolus. She said it is the volume and speed which are the factors. Mr. Myers says it is almost always fatal. Dr. Bowen replies that can be the case with adults, to which there have been medical reports published. A clinical note refers to the purple blotching pink and active for child B and is shown to the court. Mr. Myers asks if pink and active refers to the baby. Dr. Bowen replies, yes. The prosecution, led by Nicholas Johnson KC, is clarifying a few matters from Dr. Bowen's evidence. Dr. Bowen said she needs to be completely independent and base her conclusion on the evidence presented to her. The blood gas record is shown to the court. Dr. Bowen says one of the parameters from a blood capillary reading, a PO2 recording, is typically disregarded as it is not reliable. Dr. Bowen presents a UVC to the court and explains how it is administered and left so there is no air left in the tube. She explains a long line looks similar but has a wire inside it. Dr. Bowen clarifies she has never heard of a case in clinical experience or in educational courses or in published literature of a neonatal having an air embolus as a result of negative air pressure as described in the medical paper concerning air embolisms in adults. Dr. Bowen is asked if there is any link between child B not getting fluids and the collapse which happened 20 to 30 hours later. Dr. Bowen replied, no. A note dated July the 14th relays a progress report for child B. Mr. Johnson asks if there is any evidence of breathing problems in that note. Dr. Bowen says, there isn't. Dr. Bowen says the colour change on its own is not diagnostic of an air embolus, but needs to be taken into context with the sudden and unexpected collapse. Nicholas Johnson KC for the prosecution explains to the jurors he will now read a summary of the police interview LucyLetby had in respect of Child A and Child B. The wording of the summary has been agreed between the prosecution and defence. For the case of Child A, the first interview took place in July 2018. Letby was allowed to look through the case notes and was asked if she remembered the specific shift. She replied, yes. Letby gave details of the handover and the long line administration. She said she checked the fluids and the nurse colleague had the bag out. She said they noticed Child A was pale and mottled and a crash call was put out. She said full resuscitation attempts followed. She said Child A had been a little bit jittery in appearance and believed that was due to low blood sugar levels. She said a colleague was there with the fluids at the handover. She said Child A went pale after a colleague had connected the fluids. She said Child A had, quote, gone pale about 5 minutes after the fluids were administered. She said Child A had a rash-like appearance, which Letby put down to the result of an infection or being cold. Quote, he was more pale than the areas of the mottling. She was asked if anyone else had seen the mottling. Letby replies, yes. She said they were advised to stop administration of the fluids. Child A was then not breathing and Dr. Harkness was called over. Letby said she could not recall Child A's resuscitation, but recalled Dr. J-Ram had entered the room. She said the death of Child A, quote, had been difficult for her, and said there was a support network among the nursing team. She said she could not recall who attached the fluids line, but believed it was her nursing colleague Melanie Taylor who had connected the fluids. She said photos were taken of Child A in accordance with the parents' wishes on their phone, along with a lock of hair and hand and footprints. She agreed she had been taught to prime lines so air could not get in them. She denied having done so via Child A's long line or UVC. She said she didn't know exactly what an air embolism was. She said her relationship with the child's parents was, quote, strictly professional and could not explain or remember why she had searched the mum's name on Facebook several times in the following weeks. She explained for a later search she may have been searching for their names for an update on Child B. For Child B, Letby explained the discoloration was a different appearance to that of Child A. Child B's appearance was observed before resuscitation attempts began. She did not recall having had any concerns for Child B or any alarm going off for her. She confirmed she would have handled Child B to an extent for medication and to attach lines. She said she did not recall how upset Child A and B's parents were at the time. The jury is now being walked through the sequence of events for Child C, with the evidence as was for the case for Child A and B being shown on an interactive display to the court. The electronically stored evidence is also available to view on the jurors' iPads. The jury is informed that, as they are increasingly used to the system and the descriptions of types of medical records, this process will go quicker than that for Child A and B. Text messages exchanged following the deaths of Child A and B show LucyLetby asking if there were any spare shifts going, adding, quote, think I need to throw myself back in on Saturday. The response, hopefully it might settle down by then. Letby, I think from a confidence point of view I need to take an ITU, intensive treatment unit, baby soon. The response, it does knock you a bit when things like that happen, but it's okay to have some time out as well. Enjoy the sun. The court is shown the nursing night shift for June 13th, with a different nurse identified as the designated nurse for Child C and Letby being a nurse for 2 other babies. A message sent to Letby on June 13th at 9:48 PM says, you okay? Letby replies, quote, I just keep thinking about Monday. Feel like I need to be in room 1 to overcome it, but nursing colleague said no. The colleague responds, quote, I agree with her. Don't think it will help. You need a break from full-on ITU. You need to let it go, or it will eat you up. Letby responds, not the vented baby necessarily. I just feel I need to be in room 1 to get the image out of my head. Letby adds, quote, it probably sounds odd, but it's how I feel. The colleague responds, quote, well, it's up to you, but I don't think it's going to help. After further messages are exchanged, the colleague suggests, quote, why don't you go in room 1 for a bit? Letby responds, quote, yeah, I have done a couple of meds in 1. Letby later adds, quote, "Forget I said anything, I'll be fine. It's part of the job. Just don't feel like there is much team spirit tonight." The colleague replies, quote, "I'm not going to forget, but I think you're way too hard on yourself." Letby referred to previous events she had seen in a women's hospital and the support available following such events. The text message conversation on WhatsApp concludes at about 11 PM. Child C collapsed 20 minutes later. Okay, now that concludes day 13 of the trial concerning Lucy Letby. If you wish to stay up to date with all of the comings and goings concerning the court process, then don't forget to hit the thumbs up button below and subscribe to the channel. As always, many thanks for joining me for this video. I look forward to seeing you all again for the next one. Take care. Cheers.